So, I guess we are about done with the chairman's report, except for we have a few speakers. And she is not listed on here, but Teresa Harmla will start with her first. She's got a little update for everybody, what she's been working on since the last meeting. And to me, it sounds like some good news. And I promised her that nobody would beat her up too hard today either, like the last time.
Well, it doesn't look bad last time. So we're real excited that we are finally at a point where we have created a sustainable system, because again, like I had said last month, that we're looking at a vaccination clinic that would be weekly and sustainable without necessarily saturating our team in the office, because there's other things to be done. However, we will definitely be involved every time we're there. So it'll be on Thursdays and Fridays. The vaccine has a limited amount of time that it can be off-site. So we will work within that time period. We've created a system where it's just a link that you will have on our website, on Facebook, probably on our county website, as many people as we can get in to schedule. We have 100 vaccines right now, and we're doing a soft start this tomorrow and Friday. And what I mean by that is we have the system for scheduling. We also have the team that we hired. There's 5 nurses and 2 EMTs that will be able to support the clinic. So we're having an orientation with them in the morning, and in the afternoon we have 40 that we have 100 total, so we can do 40 tomorrow and 60 on Friday. We are slotted to get 400 next week. That is in compliance with the state, getting our educators taken care of, but also balancing that with our 65 and older and everybody else that we want to get in there. So that's great news. We're real excited about it. We've been working with Menominee Tribal Clinic as well as Stockbridge Muncie. It's been incredible with getting people through. So we're really partnering and finding those providers that are starting to get the vaccines in. Quit Pharmacy, and there's a couple of others that I want to reach out to so that we can have a network of people. We don't care who's poking the arms as long as it's safe and given to the people that want it.
And then hopefully this will be continuing correctly.
We wanted to make it sustainable for about 3 to 6 months, and it should be all of that. So, until we get to a point where it's manageable.
And there's no guarantee of the allotment you'll get.
Yes, I'm really glad you brought that up. So the way with the scheduling, we're working with the scheduling on a week-to-week basis, because that's when we know how many vaccines we're going to get for that next week. So if I find out on today what we'll be getting next week, then I can open up that many slots for scheduling. Like I said, next week is a little bit with the schools and balancing what we have left over. However, Stockbridge Muncie, like I said, has really supported the school systems as well. So hopefully we'll be able to get down that list.
Okay. You have a question, Jerry?
Yes, I do. I know I brought this up last month, and I'm going to bring it up again, simply because I've had some elderly people contact me, who are older than me, that said they don't have a computer, they're not on Facebook, they need a phone number to call here at the courthouse or someplace, and that information has to get out to them so that they can see it, because she said she's been trying to get a hold of the nurse's office, but there's been no, quite honestly, help, she said, because they haven't gotten any answers. So what can be done as far as communicating with the people out there that are not online?
Right. And I'm glad you brought that up. I don't know. We do have a list of about 70 people that we're reaching out specifically for this, tomorrow and the next day. So I don't know if she's on that list or not. But if people are calling in, And I was really kind of thinking about, can we recruit or talk to maybe a library or somebody somewhere where they could go to find a computer? And the only reason I'm saying that, because I thought about, we thought, okay, people can call in and make that appointment. Well, by the time they call in, everybody else that can be online is going to get those appointments. So that didn't end up being the best way to do it. However, I know my staff has been taking names, so my apologies, and maybe we can get together and make sure that we've got that person, but we've really been trying to create a list so that we can go down that list. Another option as well when we're calling people, and if we don't have an appointment available, then our question is, if an appointment does become available while we're doing this, say somebody doesn't show up or is ill that day or whatever, can we call you and would you be available in the next 30 minutes to come in and get that vaccine? So that's another option that is present too.
Okay, and I believe the ladies in Ag and Extension are going to help you out with some of the phone calling and that, or is that no longer part of it?
Yeah, that because of the appointment thing, ended up not necessarily being the best way to reach those people. But I'm working with Aging Resource Center and whatever partners that we have to work out. We do have a couple of volunteers, and Extension will be helping with that. So they're going to be able to kind of be support staff for the rhythm and flow of the vaccination clinic for this week.
And you are going to put out, you had told me the other day, a press release.
Right, yeah.
Once you get this up and going.
Correct.
So it will be in the paper and on the radio.
Correct. We really want to get this week just kind of getting that soft kinks out of there so that when we do a press release, which will be next week, then we'll have solid information.
Okay. I have a couple other people that have questions for you. Marvin?
Yes. Is Shawano County just limited to a certain number of doses? Because we're one of those, like Jerry said, are trying to call in. We always get the information, sorry, there are no doses available. And we would be qualified, my wife and I would be qualified much sooner, but no phone calls accepted?
Well, I'm not quite sure about your situation, but as far as the doses that we've gotten so far.
Are you talking about are you talking about the Shawano County Health Department?
The Health Department.
Okay, thank you.
Yes, thank you. Yeah, the Health Department, we had received 200 doses. We were not quite ready to be up and started. However, we did reimburse Menominee Tribal Clinic because they had been doing Menominee County folks as well. This is our second dose. I asked for 200, I got 100. So not everybody's not necessarily getting what they're asking for. I had asked for 450 for next week. I got 400. The state is really working on trying to get these numbers up all the way around. I know ThedaCare has been back and forth. They have them, they don't have them. They have them, they don't. WIT as well. Yeah, I know. I mean, they're calling me like, what can we do better? And it's like, well, get us our doses when we're asking for them so that we can get them out.
Okay. And possibly another way to, there is going to be a phone number that they could call in on?
I honestly think well, and I'm going to talk to TS again. We had talked about a hotline for that so that the phone number goes directly to COVID rather than getting filtered amongst all the other calls that we get. So it would, talking to TS about that.
Okay. And I would suggest then too, as soon as you get that done, if you do have a number for that, you could pass it along to the radio station. And that would help to get the number out for more people of where they can call to start getting some answers. Okay. Gene, hobby.
Yes, I was wondering, is New Cap helping you at all?
There was some hiccup with our first conversation was really good, and thank you for that referral. For some reason, it wasn't me, it was one of our other staff, but when they had tried to reach out again to follow up, I don't know if he had the wrong number, but they had said that they had not gotten any connections, so I sent that email this morning, so we will be working with them.
Second is that Dr. Rai is on Channel 2 on Tuesdays and Thursdays. And if you've got any information about when you're gonna start or anything, and phone numbers, call up Channel 2, it's all free information, and you don't have to pay for this. And all the stations that you can call in, that's free, and you can get that on the air so people know that we're doing something in Shawano County for the people. And I think that's really important, you know?
Yep, yeah. What?
Pardon?
Oh, we're gonna continue, or were you done?
No, that's it, Gene?
Yeah, that's it.
Okay,
Okay, I
yeah.
do plan on that.
okay. Deb, Nafke.
Same comments that Jerry had with elderly folks that'll call and say, "Oh, I can't get through to anybody at the health department, are they doing anything?" Not everybody gets the paper, not everybody's online. As far as call-ins, why don't you put those people on the list for the following week?
We do, and that's what we plan on doing. I'll be honest with you, when I look at our phones, we don't have messages on there. So if we have one person in the office answering phone calls, and that might be something that we can work with extension with the hotline and that kind of thing. But if people leave voicemails, we do follow up with those, and I've not seen messages on our phone that have not been addressed. So I'm not quite sure where the disconnect is with that. But we are taking names, and we are taking a list.
And then the other question would be is, do you foresee doing a standby list to tell people, okay, you're on standby because all the slots are filled, but if we have extras, I mean, is that a possibility?
That's exactly what we're doing, yes.
Okay. Aaron, Damerl.
Where is this happening?
Great question. It is at the Lakeland Center for as long as we have it available. You will come in the entrance. There will be a traffic control person there. They will hand you a clipboard with the information that we need. Jennifer Epic, are you sick today? Those questions. And also the information about the immunization or the vaccine. Then you're going to park in front of Lakeland Building, just the nearest parking, and your time of your appointment, after you get your paperwork done, a sticky note will go on your windshield. I guess Culver's does this, but then we have another processor that would be looking and manning that and calling in one by one. They will ask those questions again, verify information, and then escort them to a nurse. We have 4 nurses that are giving vaccines. The nurse will go through her processes, and then after that, we have a runner that would take them over to the observation area. We have 2 EMTs that would be doing the observation, and we have someone that will be scheduling their next appointment for the second dose.
So it sounds like you're getting it set up for the Lakeland Center, but is there any plans to expand the clinic to the other parts of the county for the elderly people that don't have the ability to travel?
Sure, and I had a conversation with Heidi Russell this morning, and we're kind of hammering out what that can look like. I know Theta Care had been kind of kicking around some things, and again, because this is so structured, we really need to do it where it's sustainable and not a knee jerk where it's like, well, that didn't work or somebody had a problem. So definitely in the talks of that's our next step. This is what we need to do next.
Okay, 'cause there are community centers in Burnawood, in Wittenberg, in Tigerton that, I mean, probably have enough space to do something like this. And
Right.
there's a large population that doesn't have the ability to get anywhere, so.
Right, and special needs is another population that we're considering on, okay, what do we do? How do we support that?
Thank you.
Okay. All right, I see no other questions, so I guess thank you very much, Terry, and stay on it.
We'll keep up.
Keep moving ahead.